Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 42. Hello, True Health seekers. Welcome to another exciting episode of the Learn True Health podcast. There was a bit of a break that I took, and if you are a regular listener, I apologize. I really want to get several interviews out a week, and if you have been a regular listener, you might have heard the episode where I interviewed one of my friends, Barnetti, who is battling breast cancer. She started a new business in order to raise money for her treatments, because if you want to battle cancer naturally, it costs a lot of money out of pocket, because of course insurance only pays for the cut, burn, and poison method of getting rid of cancer. And so she started a new business, and I had jumped in, my husband and I jumped in and have been helping her build her business. It's actually amazing. If you are a female and you love clothing, which who doesn't, you can check her website out, lulaheroes.com. That's LulaHeroes.com. And she is selling LuLaRoe clothing, which is really comfortable and gorgeous clothing, great for summer, great for the heat that's going on right now. And so I took a step back from the podcast in the last week in order to support her in her business. But I'm still committed to doing this, and I absolutely love interviewing these amazing experts. In fact, in the last few days, I've interviewed just some absolutely amazing people, and I have some doctors lined up that you are going to love. In fact, yesterday I met with a doctor who has been helping people cure cancer, which of course is very risque, and the authorities went after him and he had to declare bankruptcy, but he has testimonials of people who had tumors the size of melons that the mainstream doctors had given up on, had basically said, okay, you have less than 6 months to live. And they found this doctor and they went to him, and he worked with a handful of scientists that helped formulate almost like a very specified treatment plan that turns on the immune system to attack the cancer cells. And it worked over and over and over again until the larger organizations that profit from cancer treatment were threatened. So we're going to be interviewing him soon, and he gets to tell his side of the story, which is absolutely amazing. This interview that you get to listen to today is a Dr. Phil Carson, who is a pharmacist, and he's been practicing for many years as a pharmacist. He's inside the machine, inside the drug, the big pharma machine, and yet his entire motivation as a pharmacist is to help people get off their medication. And in fact, he does it very successfully. So when people come to him, he helps them find natural remedies that allows their body to correct itself so it no longer needs the medication. He is an expert in helping children get off of ADHD medication and live healthier lives. He's helped people with weight loss, with pain reduction, getting off of their pain meds, ending GERD or acid reflux, getting people off of their cholesterol medication. The list goes on and on. I was so inspired by Dr. Phil Carson. I really know that you're going to love this interview, and we will be having him back on the show because he has so much to share. Thank you so much for being my listener and for taking in all the information in these podcasts. My goal is to interview experts that help people recover their health holistically. If anything inspires you about our podcast, please share it with your friends and family. We're going to get this information out there so that there are... I don't want to take MDs away from people. It's not like I think that, drug medicine is always bad. I think it has its place. But people need to know that there are more options that work. There are effective methods that doctors are using that don't just resort to drugs and surgery, that there are other methods that will give them optimal health. I want to help you have optimal health, and I want to help your friends and family have optimal health through these interviews. So please share them. And if you have any feedback for me at all, please email me, ashley@learntruehealth.com. I'll reply to you. I'd love to hear from you. I want to know, what are you interested in learning? I have in the works several really high-profile doctors that I'm going to be interviewing in the next few months. So I'm looking forward to bringing that information to you. But if you have a health author or doctor, or you have a personal doctor that has helped you and you'd love them to share their story and their health tips and tricks, then please let me know their contact information. Email me. I would love to get more great doctors on our show. Or it doesn't have to be a doctor. It can be a holistic health expert. My email again is ashley@learntruehealth. And thank you so much for being a listener, and enjoy the show. Well, I'm so excited to have you here on the show, Dr. Phil Carson, who's a doctor of pharmacy. Welcome to the show.
Thank you, Ashley. I appreciate it. It's an honor to be with you today on Learn True Health. I really appreciate the invitation.
Excellent. Well, and I've listened to your podcast. I really enjoyed the latest episode where you talked about the addiction to sugar. I've personally had that experience, and I've cut sugar out, and I see that you promote stevia on your website, and I love stevia. I didn't love it at first, but after going completely sugar-free, it's like stevia becomes a great treat. So I loved your website. Definitely recommend my listeners check it out. carsonnatural.com. That's CARSON natural.com. You've got a podcast, you've got a blog, you've got a free ebook, you do coaching, you're a speaker. You've been helping people for 31 years recover their health, and it seems like you've gone from the drug-based medicine into seeking the, and I hate using the word alternative medicine because it's like the most of the time more effective. So you've been seeking out the most effective forms of medicine, which a lot of the times comes in the form of natural medicine. That's really, really exciting. So I'd love for you first to share with us a bit about your journey, a bit about your past, and what led you on this path of going from drug-based medicine into seeking the information and helping people find solutions naturally.
Absolutely. Yeah, well, I was traditionally trained as a pharmacist, graduated from pharmacy school in 1985. And when I went through pharmacy school in the 80s, 70s and 80s, I was taught the history of natural medicine, not the application of it. Natural medicine was a thing of the past at that time, pretty much in the medical area field as far as medicine and pharmacy. So I didn't learn all the great things that I know now about natural products and natural therapies and natural medicines. So when I was practicing pharmacy, after I've been out for a few years, people started coming into my store asking me, hey, can you tell me about this particular herb? Can you tell me about these particular vitamins, minerals? And I didn't know what to tell them. And I didn't like that. So I said, well, I've got to find the answers. I don't like not being able to answer somebody's question and not being able to help them when they're seeking my help. So I started taking courses and learning everything I could about natural medicine, natural therapies. I traveled the country going to different weekend courses and seminars to learn everything I could. And as I began to learn these things, I began to apply some of these things to my own health. Because I had worked in an extremely stressful situation in a pharmacy operation that I started out in when I got out of school, and my health had really declined as a young person. I was suffering from chronic reflux and heartburn, indigestion. I slept in a recliner most nights because I couldn't lay down in the bed and sleep without horrible reflux issues. I gained a lot of weight. I was just, not sleeping well, stressed. And these things I learned to apply to myself, and I saw tremendous results. And I began to take the things I was learning and share it with my patients and make recommendations to them. And I would, they would come back and say, wow, can't believe, the difference. I can't believe, thank you so much for what you told me. You've helped me tremendously. And, that was extremely rewarding, still rewarding today. And that's one of the main reasons why I do what I do, because of the, the ability to be able to make a difference in somebody else's life, especially when it comes to their health. And so that was something that, those things just fueled the fire to help me learn even more. And I'm still learning every day. As you well know, new things are being developed and new discoveries all the time. So it's a continual learning process.
Have you ever helped someone get off of a prescription medication because of your guidance? They were able to no longer need it?
Absolutely.
Really?
Yeah.
Like what kinds of medications are you successful at helping people get off of?
Primarily diabetes medications. Because that's the diabetes care is one of my specialties. I'm a certified diabetes care pharmacist. So I work with quite a few diabetics and pre-diabetics as well. In implementing lifestyle changes, using certain supplements, that's happened several times where they've been able to reduce medication dramatically or get completely off of some of their medications.
I had the exact same experience. I had diabetes, type 2 diabetes, and I got on Dr. Wallach supplements that they were introduced to me. Lots of chromium, vanadium, lots of trace minerals, and then of course cutting out the SAD diet, the standard American diet, and eating a more whole food diet. But through that, I was able to very quickly get my A1C hemoglobin down within the healthy ranges, and I felt absolutely amazing. But when I sought out a nutritionist, she wanted me to eat more carbohydrates and more junk food. But in my mind, it was junk food. But what I saw was that there was this conflict between the educators, a lot of the diabetes educators out there, and what it takes to become no longer diabetic. There was a conflict, and it was almost like these nutritionists were taught, these dietitians were taught, sort of like what the pharmaceuticals companies would want them to be eating in order to stay diabetic.
Yeah.
Have you seen that?
I have, and it saddens me deeply because what I have seen numerous times over the years is I've had patients of mine that would be on some oral diabetic medications and they would be doing fine. They would go into the hospital for whatever reason and they would come out of the hospital on insulin because their sugar was so out of control while they were in the hospital. And the reason why is because of what the hospital was feeding them. Supposedly a diabetic diet, but they were loading them up with carbs. And it's no wonder that the sugar got out of control because of what they were eating. It was supposed to be a diabetic diet based upon the American Diabetes Association standards of what they call a diabetic diet. Now, thankfully, they've wised up to some of that stuff and they have made some changes. I was at diabetes symposium last year and I was happy to hear a lot of the talk about carb control and not eating these certain types of carbs and glycemic index, things that they weren't talking about a few years ago, but now they're talking about it. So I've seen that quite a few, too many times.
I can imagine that some listeners might be interested in your coaching service at this point. I know that a lot of listeners are on multiple medications simply because statistically over 70% of the adult population in America is on at least one prescription medication. And so if there's people out there who are on multiple medications and they want to, like I see on your website, you've got this coaching service. Is that something that they could Skype you and you could kind of give them some guidance around that?
Absolutely. I do that with several people. I've got clients in different parts of the country, and we communicate by phone and by Skype. So yes.
That's great, because I can't imagine that all doctors of pharmacy are as motivated as you to have sought out this information, all this education that you're really, I can see by your bio that you're constantly seeking out the information in order to help people naturally. So that's amazing that there are pharmacists out there like you who want to do that, because my experience in the past has been that pharmacists are very helpful. They want to help, but their training has taught them their scope of practice is within drug-based medicine. So,
Exactly.
yeah. So you cured yourself of GERD, of acid reflux. What did you do in order to cure yourself?
Well, I first learned about digestive enzymes in one of the courses that I took. So I started taking digestive enzymes. That helped tremendously. And then in doing some of the research and reading for what I was doing, I learned about the problem of people having what's called low stomach acid. The medical term for it is hypochlorhydria. And I found out that it's real common with people with blood type A. That's my blood type.
Interesting. I've never
And
heard that.
yeah, and so I started doing a little more research and stuff on it, and I read some articles written by Dr. I'm trying to remember his name. He's got a clinic out there in your part of the country, in Tacoma, Washington. Um, I can see his face, but his name's not coming to me right now. But anyway, I'll think of it in a minute. But he actually wrote a book on low stomach acid, and so I started supplementing with an acid supplement. First, I tried just pure lemon juice. There was a little simple test that was recommended. You could use apple cider vinegar or fresh squeezed lemon juice, and so I did that, and I got immediate relief. So I started supplementing with an acid supplement. It's called betaine hydrochloride. And betaine is similar to the acid produced by the stomach. And when I started using that, it was amazing. So the combination of the digestive enzymes and the stomach acid supplement made all the difference in the world. And I also added one other thing. I did probiotic supplements, and that helped tremendously as well.
I definitely want to talk about probiotics in a sec, but first, your training as a doctor of pharmacy, was your training when someone had acid reflux to inhibit the body's ability to create acid by putting them on proton pump inhibitors or antacids, completely contradictory to what actually worked in order to heal your GERD?
Yeah, yeah, yeah. See, I was taking antacids. I was drinking. At one point, I was drinking a bottle, sometimes almost 2 bottles of liquid antacid a day.
Wow.
to try to function, and it was that bad. And I started taking other types of antacids and other types of antispasmodic medications to help control the gastric issues I was dealing with. And yeah, and then what I learned was I was doing the opposite of what I should have been doing. My stomach acid was way too low, and that's why I was not able to properly digest my foods in a timely manner like they should, and that was causing the primary cause of the reflux. And by the way, that was Dr. Jonathan Wright that came to me. I knew it would. That's who I was trying to think of, that has the Tacoma clinic out in Tacoma, Washington. But Dr. Wright is who he wrote the book about stomach acid that I was talking about.
Very cool. Well, we'll have to check that out. Well, if anyone has GERD and they haven't been able to get rid of it, then they should just follow your advice or get your coaching. I think someone who is a healer who heals themselves has the most conviction, and so
Oh yeah,
it's those healers who have put themselves on the path also, because then you can really speak from experience and help people from that experience. Now, before we started recording this podcast, Dr. Phil and I were discussing the most famous American in our generation. And because I said to him, "Where is your accent from?" And he said, "Well, I live in the same place as the most famous person in America." And I said, "Elvis." And he said that I was the first person to get that right. And we discussed Elvis a little bit and talked about how it was, it's sad how his life went the way it went, and it kind of is like how most Americans are going. I mean, besides the, being famous, but in terms of the stress eating, needing to resort to drugs or substances in order to stay awake or stay, and get their energy up. We're kind of going down that path. We're following Elvis's footsteps, and we don't want to end up, ending our life the way his did. And so we want to stop those behaviors. But what's really the root cause? Why are people craving the foods they crave? Why are people, I think we're really smart. I don't think we would be driving through, getting, Krispy Kreme donuts and fried chicken and fast food, laden with sugar and MSG and neurotoxins and addictive chemicals, if we knew what was the root cause and we could get to the root cause. So we were talking about gut health, and that there's actually a connection between our neurology and our gut, and that you are kind of an expert at this. Can you share with us why is maintaining a healthy gut flora so important, and how does having poor gut health lead to much more than just digestive problems?
Yeah. Well, this is something that I've been studying quite a bit, and there's a direct connection, because we have most everybody is familiar with the central nervous system. Your brain, your spinal cord it makes up your central nervous system. But we also have another nervous system that is around the gut, and is part of what we call the gut, the digestive area, and that's called the enteric nervous system. Well, what research has found out is that the enteric nervous system communicates with the central nervous system on a continual basis. They're interconnected. So what happens is when that enteric nervous system that supplies the gut area is disrupted, it can then disrupt our central nervous system. And an easy analogy or whatever that I use to explain that to people and help people understand is, you think about when you get nervous. Say if you've got to stand up in front of a crowd of people and give a speech or whatever, you're not sick at your stomach. You don't have any stomach issues beforehand. But when you start thinking about all that and you get nervous and you get anxious, what happens to the gut? Some people get sick at their stomach. They throw up. They get diarrhea. And it's all because of what was going on in the brain that triggered all of that in the gut. And so that is, proof of a connection there between those two nervous systems. Another thing that I explain is especially from a pharmaceutical standpoint, is a lot of the psychotropic drugs that people take this day and time, whether it be antidepressants, anti-anxiety medications, the medications for various, what they call psychotic disorders. All of those medications, the primary side effect of them are gut related. They work on the central nervous system, but they disrupt the function in the gut, and they cause constipation primarily. They can also cause, in some people, diarrhea. And sometimes it's just stomach cramping or intestinal cramping. All of those are side effects associated with those drugs, and they're the most prominent side effects with those drugs are the digestive side effects. So There is a direct connection between those two nervous systems. So if your gut is out of balance in some way, if you have some type of issue going on that's digestive related, like what I was having, of course, that affected my psyche. It affected, my ability to focus and concentrate, my ability to sleep well. And it was all because of disruption in the gut. So that is a major issue with a lot of people this day and time. And a lot of the emotional disorders, emotional problems that people are dealing with, or nervous system issues that people are dealing with, I think we need to look first at the gut and see what's going on with digestion. Is there are there digestive problems? Is there chronic constipation? Is there irritable bowel condition going on here? And these are things that need to be looked at instead of saying, hey, well, you've got depression, you need an antidepressant, writing a prescription drug
Right.
or for a medication that could easily be, for symptoms that could easily be corrected if you just cleaned up the gut, or if you stabilized the gut and got the digestive system working like it's supposed to.
How do you help people, clean up the gut, get the gut into a state of optimal health?
Well, I always start with the diet. In coaching people and whatever health issue they're dealing with, I start with the diet. Because if they don't have a good diet, they're not eating properly, that makes all the difference in the world. So you can't clean up the gut if you are not eating the right foods you should be eating.
So for those who think they might have a gut imbalance, can you give some specific things that they can do in terms of shifting their diet to support their gut health?
Yeah, eating healthier, cleaner foods is the primary thing, and that's thing that I work with people on. First and foremost is their diet. When I'm counseling with somebody, coaching someone, we focus on the diet first and foremost. People are eating a lot of junk foods, or eating foods that are not even real foods. So one of the best things they can do is start eating real food, fruits, vegetables, or things that are going to help, foods that are rich in fiber, as far as helping clean up the gut and improve digestive issues. Those fiber-rich foods are extremely, extremely important. And also drinking sufficient amount of water. And sometimes drinking water, period. Because a lot of the patients that I deal with, they drink very little water. Some drink no water at all. And that just blows my mind, that somebody that doesn't even drink water. So getting them drinking water, getting them off of sodas or whatever sugary drinks that they're drinking is another thing that's essential for helping do that and clean up the gut and get it working properly like it should.
Excellent. And what do you think about eating fermented foods in order to get those healthy cultures? Do you think that's effective?
Absolutely. And a lot of people don't want to do that. So the next thing I would have said would be probiotics. But I recommend using the fermented foods as much as they possibly can and will. But a lot of people just don't like them. But the ones that do, I say eat them on a regular basis. If you can find, good yogurt, real yogurt, not the sugar-free stuff, not the fat-free stuff. I tell people to stay away from those, get the real stuff. And there's other good foods like sauerkraut. One of my favorites that I like is kombucha tea. And there's all kinds of good kombucha tea products on the market now. It's becoming more and more popular, and I'm glad to see that. And there's a lot of companies, especially out in your part of the country, that are making kombucha teas. And we don't get the variety here in my area where I live, like you have out west. I visit out there every so often, but um, we do have a few, but yeah, they're really good.
You know, I just interviewed a few weeks ago Dr. Megan Saunders, who's a naturopathic physician, on kombucha, and she said that she was like absolutely floored, amazed that one of the local pharmacies near her, like a Walgreens or Rite Aid or something like that, like a real, chain pharmacy store,
Hmm.
had a kombucha section.
Yeah, yeah,
I
that's
just couldn't
awesome.
believe it. Yeah, exactly. It is awesome. And kombucha actually tastes really good. And I have tried a bunch of the varieties out here and they all taste
Hmm.
different. So you can kind of find one that you really like. But yeah,
Yeah.
it's great to hear from you this confirmation that from another doctor that kombucha is healthy for gut health. And would you say if you had a choice between giving someone a probiotic and getting them to drink kombucha on a regular basis, which one would be more effective?
Um, I would say the kombucha, because it has a dual purpose, because it helps with aid in digestion as well, in breaking down the foods, because of the acid content in there. It does help tremendously, similar to apple cider vinegar. And there's a lot of people that use apple cider vinegar for digestive issues and digestive aid. So the kombucha is a more flavorful way to do that. But I will point out one thing, Ashley, that what I have learned with the kombuchas is there's some of the varieties, some of the brands out there are are pretty heavy in
I
sugar.
was gonna ask you, that was my next question, was what were your thoughts on the amount of sugar in kombucha? Because that was one of my concerns when I was drinking it.
Yeah, so I read the labels, and I encourage everybody to read labels, because you can and learn how to read labels, because there's so much you can find out about a particular product and whether or not how good it is by knowing how to read that label. But yeah, that's one of the things I look for, is the sugar content, and some of them have 2 to 3 times more sugar than others do. So I try to get one that has a lower sugar content when I'm shopping for the kombucha.
Now, you just brought up a really interesting point that we should learn how to read labels. And I know that I believe it's the FDA just approved a new labeling system. They're shifting how the labels are, what would the requirements, the minimum requirements on labels, like fiber and carbs,
Hmm.
and they're making the serving size more clear, because people would be sort of fooled. They go, oh, it's only 100 calories, or this is only 3 carbs, and they find out that there's like 62 servings in this bag. Each chip is 100 calories,
Hmm.
and so they are shifting how the labels are being made, and so but when we look at the ingredients and we look at labels, this is kind of a section of our life where we're needing to be self-taught, because we didn't, they didn't teach us the true, healthy lifestyle in high school or college, unless we, opted in for those courses. And so,
Hmm.
is this something that you can teach, or I'd love to know if you have a podcast episode about how to read labels, or if you're going to, if you have a blog post, or if you're going to have a blog post about how to read labels, to teach us and the listeners about how to read labels, to make sure that we're choosing the right options. Because I think that would be really beneficial for all of us.
Yeah, that's a great idea. That's something I need to do. I haven't produced a blog post on it yet, or a podcast, but that's a great idea. I have talked about it in the course that I teach, though. I teach a course called Fit in 49. It's a 7-week course that I do. And in that course, I do talk about the labeling, and I go through a part that talks about the labels, and reading the labels, and looking for specific things on that label that you want to avoid, that are unhealthy, or can be toxic, actually toxic ingredients that are in a lot of products that you don't know that are there, and how to find those ingredients, because these companies, a lot of these companies, especially with the multivitamin products, supplements on the market, not just multivitamin, but all supplements, they've gotten real deceptive. Used to years ago, you would have at the bottom of the label, after all the nutrients were listed, you would have other ingredients. And in that other ingredients, that's where all the bad stuff was listed, like the FD&C yellow, the FD&C blue, the aspartame, the other artificial ingredients and artificial sweeteners and all the fillers and dyes and different things that were in there. Well, now they've gotten deceptive, and what they do now on a lot of these labels is that they take all that bad stuff and they interdisperse it in with the good stuff. So you may read, chromium and vanadium and calciferol or whatever nutrient is there, and then all of a sudden you see FD&C yellow, and then you'll read a few more nutrient names, and all of a sudden you'll see aspartame. You'll read a few more, and you'll see titanium dioxide. So it's kind of mixed in, so it gets kind of hidden. But a lot of people don't realize that, and they think and they look at it and they don't see all these bad stuff listed at the bottom anymore, and they think, well, this is okay. They don't have all that bad stuff in it. You got to look a little closer.
Wow. Yeah, it's kind of scary. Speaking of like the dyes, I was given when I was pregnant a bunch of samples of vitamins. Here's your prenatal, and they dyed them pink. And it's like, oh yeah, because I'm a woman and I'm pregnant, I need to, take a red food dye to, remember to take my little pink pill. Of course, I didn't opt in for any of those, but they don't need to add dyes to supplements. It was very, very interesting. So your course, what is it called again?
Fit in 49.
And what does the 49 stand for? I'm thinking like 49 states.
Yeah. 49 days.
Okay, got it.
Yeah, it's a 7-week course. We go through. It's 49 days, so 7 times 7, 49. So we call it Fit in 49.
I like it. And is this an online course? Can anyone take it, or do you do it in person?
It's an online course. I've taught it locally, and it's also available online. I'm going to be doing a webinar or online training with the course sometime in the very near future. It'll be available as a live online training. Right now it's a recorded course that's on there. We're going to be working to revamp that and change that up and offer it as a live online training for a period of time as well.
Cool. And is that, what kind of person should take that course? Is it someone of any age, or is it people that are older? Like what kind of person would benefit from taking that Find in 49?
Any age would benefit from it, but primarily the people that have taken it are older people, baby boomers like myself, people that are looking to live a longer, healthier life. They want to learn some things that can help them make some changes in their life and be proactive, because a lot of what I discuss in there and we talk about in the course is that just being proactive and making the lifestyle changes that you need to be able to live a healthier, more productive, enjoyable life with
Cool.
whatever years that you end up with.
Yeah, that sounds great.
I talk to people about that, and it's, and I mentioned this the other day on my Facebook Live episode that I did. It's, everybody says, well, I want to live to be 80 years old, or I'd like to live to be 100 years old, or whatever. And they don't think about, in thinking about the quantity of years that you want to have, they don't think about the quality of life during those years. So if you want to have a better quality of life in your latter years, it's important that you start being proactive and doing what you need, laying that foundation to have a better quality life in your latter years.
Very cool. Well, I absolutely agree with you. I think if we want to live a long life, we need to make sure we're setting ourselves up financially and we're setting
Yeah.
up our health. We have to, I think it's the same mentality for preventive health, for preventive medicine, as to be able to have a retirement plan. It's like we have to get out of the now. Although being in the now is good, it's very zen, it's, healthy in the moment. You don't want to worry about the past or the future. But setting ourselves up so that, hey, I want to live to be 90. Okay, great. What do I have to do financially so that I get to retire and, not work for 30 years and
Yeah.
also have full health? And then in our retirement, we want to probably spend more money because we want to go traveling and do all kinds of activities. So that kind of mentality is, it takes setting ourselves up now and creating a plan now and educating ourselves now so that we can make sure that we're taking care of ourselves 30 years down the road, which I think is lacking in, at least in my experience in the last 36 years in
Hmm.
our society. We're not taught to set up a retirement plan, and where the younger generations are not taught to think preventively.
Yeah.
So we're taught to, just be spontaneous with our money, be spontaneous with our health, and, with our diet, and just, instant gratification. Oh, let's go to McDonald's. Let's go
Hmm.
to whatever, just eat whatever, drink whatever, do whatever drugs. A doctor puts you on a drug. Okay. I have a friend who, was put on a few medications, and he then proceeded to have episodes almost monthly for close to 6 years where he was throwing up blood. And he'd go into the hospital and they'd accuse him of everything from lying about it to just trying to get pain meds. And
Yeah.
he's like, I don't want pain meds. Finally, and he was in and out of the VA. He went to all kinds of hospitals in order to uh, because when you're throwing up blood, you want to go to a hospital.
Oh
And
yeah.
finally, and he was filling the same prescriptions, with the same, pharmacist, or with the same, all of his prescriptions were done at once. And finally, I think it was a nurse that was holding his chart and said, "Oh, these two medications you were put on like 6 years ago are known to interact, not interact well with each other and can cause this kind of episode." And so they took him off that medication, put him on a different one, and no more throwing up blood.
Yeah.
And to me, I was just like floored. I was appalled that no one, all the professionals he saw, they didn't they didn't take the time to go, oh, maybe this is a drug interaction.
Yeah.
How has that, my experience and the story of my friend, has that been something that you have experienced as a doctor of pharmacy?
Absolutely. Yes, I have on numerous times with people that have come to me and said, I don't understand what's happening. Why is why is this happening to me? And I start doing some looking and researching and find out, yeah, it's what you're experiencing, what's happening is medication related, whether it be an interaction, and we've seen that numerous times, and I used to see that quite often. For 2 or 3 years, I did consulting work in nursing homes, where I would go in and review the medication charts of these patients in nursing homes, and a lot of them would be on 10, 15 different drugs.
Oh my gosh.
And yeah, we would see those interactions, and I had to call the doctor and say, look, we got to do something here. These two drugs don't need to be taken together. Cannot do this. This is causing this problem, or it's going to cause this problem. So yeah, that was a common occurrence. Um, just had just was having this discussion this past weekend with a friend of mine who lives in the Nashville, Tennessee area, and he sent me an email and he said I've been taking this medication, and he didn't tell me. I told him, I said, I wished you'd have told me what was going on. I could have told you what was happening, but he sent had some conversation with the doctor's nurse and about what was going on with him. He had a chronic cough. He thought it was allergies. He thought it was just prolonged allergies from allergy season that it just wouldn't stop. and he was constantly coughing. Well, what it was a medication that he was taking. The doctor had increased the dosage on him, and he started coughing. And there are some medication. This is a blood pressure medication. So
Wow.
there are some blood pressure medications that will cause a chronic cough. And people will often think, well, I'm just sick, or I've got allergies, or it's something. They don't relate it to the medication. And often they're not told by the pharmacist, or they're not told by the doctor, hey, you need to watch out for this side effect. So this was a problem with him, and that's things that happen all the time, and it gets overlooked, or people don't think about it. The clinicians don't think about it, and they're trying to find out what's going on, or they're making saying, hey, well, maybe it's this, maybe it's that, and they should be looking at the medication.
Absolutely. Yes, the first thing we should do is look at the medications.
Yeah.
Well, I know if I was someone who was on medications, I would hire you as my coach, because I see the value in running past this information with you. I think having a second and third opinion, not just from doctors, like, you say, oh, get a second opinion. Well, you're going from one MD to another MD. They might be taught the same school, the same philosophy. You're not going to get a different opinion from them. You should go to a doctor of pharmacy and go to an MD and go to an ND, and get different, completely different schools of thought, but they're all doctors. Yeah. And so I absolutely love that you're offering this service, because I think people, even in other countries, would be interested in chatting with you. So I'm really glad that you do that. Now, before we wrap up today's interview, and it's been wonderful having you on the show, and I'd love to have you on the show again, because you have so many different topics that we can discuss. Yeah. I'd love to know, do you have a book that you would like to recommend for our listeners to read?
Yeah, it's an inspirational book as far as health. If you're a person that's not as healthy as you should be, or you're having some health issues, particularly if it be obesity or weight issues or whatever, there's a book that a friend of mine wrote a few years ago. His name is Ken Davis, and he wrote this book called Fully Alive. And basically this is his own personal story of how he found himself in a place one day where his health had just deteriorated. He was extremely overweight. He was not able to do the things that he wanted to do and function like he wanted to, and just through a series of events, of things that happened in his life, he was woken up to the fact that, hey, I need to make some changes. I need, if I'm going to continue to enjoy my family and be here for my grandchildren, I need to make some changes. And this book is about that, and about the changes that he made in his life, and it's a great book, Fully Alive.
Excellent. Well, that does sound like a great book. And I highly recommend listeners check out your podcast. It's the Feeling Good Podcast, and who doesn't want to feel good? So the Feeling Good Podcast, that sounds fantastic. And again, I listened to one of your episodes, really loved it. You have so much insight. I really enjoyed having you on the show. I definitely want to have you back, because you actually also are an expert in helping people with ADHD and natural and alternative treatments to ADHD. That is such a huge epidemic. When I was a kid, I feel like I was a kid yesterday, but I'm 36 years old. So back in the 80s, there was maybe one hyperactive kid in each class, and they were kind of just written off as the joker, right? Oh, that kid just wants attention, ha ha, everyone likes to laugh at that kid. Not laugh at him, but he's, wanting to laugh, because he's trying to get people to laugh. And that was it. And then all of a sudden we started hearing in the 90s about these kids being put on Ritalin. And now, and I remember a few years ago, I heard kids, as young as in kindergarten and grade 1 being put on Ritalin. And while their neurology, they're growing and the neurology is still solidifying, they're being put on drugs that will forever change their neurology and change their biochemistry. It is a shame. And the fact that you can help people and their children no longer need, and I don't want to even say need, because I don't think this is just my personal opinion. I don't think anyone needs Ritalin.
Mm.
That I think that there are a diet. I mean, in my opinion, it's diet, lifestyle, supplements. There's a lot of healthy things, but you are the expert, and I'd
Yeah.
love to have you back on the show to teach us exactly what it is that people can do so that their children can live healthy lives using natural medicine and no longer having to be on ADHD meds. So I'd love to have you back on the show for that.
Absolutely. Yeah.
Fantastic.
Would love to do that. I've worked with quite a few patients over the years in that regard, and we've had some good results. And I actually just recently attended a current symposium on ADD, ADHD, and addictive disorders that was down in Orlando, Florida, and it was fantastic. And I was there with some other clinicians that use natural means to help these patients, and it was really good. Yeah, I'd love to share that with your listeners. It'd be awesome.
Awesome. Great. Yeah. And then I just have a question. How have you been able to, throughout the years, successfully get children off of, and I don't even say children because there are adults on ADHD medication as well, but have you successfully been able to help people get off of the meds and maintain like a healthy mind, healthy emotional state using natural and alternative treatments?
Yes, I have. I'll tell you a quick story if you got a minute
Yes.
about one of the patients. This was not long after I started learning about natural alternatives, and I had a mom came to me and she said her son's name was Johnny, and she said, I don't want Johnny on these drugs. She said, I know how bad they are, what they're doing to him. He said, can you please help me? And I said, yes, I can help you. And so the things I had learned in some of the courses that I took, I told her about, and I said, here's what we need to do. Let's do this. And we worked on, with several supplements and dietary changes. And one of the greatest rewards ever that I've gotten in doing what I do was from that little boy. Twice. The first time was when he was still a little boy. He came walking in the store one day with an empty bottle of a mineral supplement that I had him on. And he said, I need to get another bottle of this. And he said, I want to thank you for helping me.
Oh.
Yeah. And it was an awesome moment for me to have that little boy do that. And then a few years ago, his grandfather died. And I was at the funeral, and he came up to me and shook my hand, and he thanked me again because he's married, living a great life, got a great job, functioning extremely well. And so, yeah, that kind of stuff is why I do what I do.
It was the ripple effect.
Yeah.
You're just living your passion, helping one person at a time, but you can see now that years later, because of that, he, all the lives that he gets to touch through his job, through his,
Yeah.
Being married and having children, and
Yeah.
it's that ripple effect. So you're on a path that is helping many people, and I'm really so I'm proud of you.
Yeah.
So thank you so much
Yeah.
for being on the show. Now, one last question. I'd love for you to give our listeners a challenge, something they can do now and for the next 7 days to improve their health.
Okay. The number one thing I would say would to be water. Take a look at your water consumption. How much water are you drinking? What kind of water are you drinking? We can't function, we can't live without water. We need it. And the thing with water is that what I find is most people just don't drink enough. And sometimes the water that they do drink is not good quality water. So I've seen it make a difference in so many people's lives just increasing the water. I've seen people's cholesterol numbers come down. I've seen back pain go away. I've seen other joint pain improve just from drinking sufficient amount of water. Skin issues get better. There's so many things that can be dehydration related, because people are moderately dehydrated because they're not getting enough water. So that would be the one thing I would say, because it's the number one thing I ask people when I counsel with them is how much water you're drinking, and most people not near enough is their answer. But the amount that we need is half of our body weight in ounces per day. So if you weigh 200 pounds, you need 100 ounces of water a day is what's recommended. And I say pure water, preferably if you're going to drink bottled water, spring water. Stay away from the purified waters that don't have the good natural electrolytes and minerals that natural spring water does. If you're in an area of the country where you can get it right from the spring, that would be even better. If you've got a spring nearby. But if not, the bottled spring water is fine.
I absolutely agree with you. We live on a well, and it's 400 feet deep, and I love our well water. But before that, we used to fill up our glass jugs there's one public well left. It's an artesian well in north of Seattle, just north of Seattle, and there's always a lineup day or night. There used to be 11 or 12 artesian wells in this greater Seattle area, and one by one the county of that area was closing it down, and the local people fought, and they kept it open, and now it's a public well. So you can Google a public well in your area and see if there's a place where you can fill up your jugs for free. And it's, like you said, it has all the trace minerals. It's purest. I totally agree with you on checking to see how much water you're drinking. Half of your body weight in ounces. Our episode, way back in episode 4, we had Dr. Molly Niedermeyer, and she has a little bit of a different formula, but I think it adds up to be about the same. She says a third of your body weight in ounces, but then on top of that, she wants you to add 8 ounces for every vice. So if you're stressed out, drink 8 ounces. If you didn't exercise, drink 8 ounces. If you did exercise, drink an extra 8 ounces. If you smoked a cigarette or had a junk food, drink 8 ounces. And so it kind of adds up to the same as yours. But that's a great formula to remember. Back when I thought I was drinking enough water, I was only drinking about 30 ounces a day, and I could not believe that was dehydration, because I thought, that's, I'm drinking this big glass of water every day, that should be enough. And now I can really, really feel a difference. When I got to between 80 and 100 ounces a day, my energy levels went through the roof. I had so much more energy, and I couldn't believe that dehydration just drained me of energy. And then you're sharing that people experience no back pain. The back pain goes away, the joint pain goes away, the digestive issues can clear up. That's fantastic. Well, thank you so much for being on the show. It has been truly a pleasure. For those who want to check you out, they should go to your website, carsonnatural.com. Definitely check out your podcast, which is the Feeling Good Podcast. And then your Great in 48. How would someone go about signing up for that if they were interested?
They could go to my website. There is a link there on the website where they can sign up for that, or they could go to carsonnatural.com/fit-in-49 and get directly to it that way.
All the links are going to be in the show notes of this podcast. Thank you so much, Dr. Philip Carson, for being on the show. Definitely want to have you back, and I'm looking forward to hearing more exciting stories about how you have helped people recover their health naturally and get off their prescription medications. All
right. It has been an awesome pleasure to be with you today, Ashley. I appreciate it very much. Thank you a lot.
Thank you. Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high-quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com And one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. Takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.